Hey everyone, this is Carl, and I just wanted to kind of touch base, talk about the quality scorecard, and I just wanted to go over what a dashboard is in essence. You know, when you talk about dashboards, one of the key elements of a dashboard, and in the sense, it's kind of your front output that has data in the back end that's supported by data extensively or kind of small data sets that can be updatable. You think of dashboards. There's other things that exist, such as in terms of public health, the county health rankings. And what that is there's a series of metrics by county nationwide, and it's created this composite national map that you could look at, scan down, and drill down. Drill down being that you can go from the state and then drill to a specific county within the state, compare different counties within different states. So that's kind of a dashboard. It's just kind of it allows you to have high level comparisons, create high level comparisons, but it also allows it to be updatable. That there could be it could be iterative in the sense, like in terms of dashboards, just kind of using this a little bit. I'm not sure if it's down here. Usually with dashboards, you kind of have a date, complete, updated as of, as a certain year, March 2013 or whatnot. But in this case, what we're looking at is just a series as a dashboard that talks about patient experience, outcome measures, and then you kind of scroll down here: organ availability, resource productivity, process compliance. Just like when I was mentioning with the county health rankings, a series of metrics, a series of measures is the best word to use here. And kind of when you think about a dashboard, you think about your topic, you think about the specific measure. Deceased, what's that mean? The number of patients deceased. When we're working along, this is a little more granular in essence. But listing your data source, the benchmark. What is a benchmark? It's a good question to ask. In traditionally a lot of health data, a benchmark is or can be a previous year worth of data or a set goal, just by discussion, by policy. It's where a policy can set a benchmark in terms of in essence, if a a piece of legislation is passed that wants to make sure that every child in a low-income health insurance program, such as Medicaid, wants to get dental access, and so legislation could be passed to say that by X year or this year, 60% of these children need to have at least one preventive dental visit. It's not necessarily rooted in anything. Could be rooted in best practices per se, and looking at other states, but also it could just be a policy piece based on research, not necessarily any indication of what's actually going on. But in this case, some of the dashboards could be that, or some of the dashboards can be prior trends, such as um, you're running a 2010 worth of data and you find a specific number like this, transplanted is 9. What that means is 9 in 2010, that there was 9 transplants in 2010. That's the benchmark, and that's the measure that you use, the variable value rather that you use to compare. In this, when you go further out, such as here, so you can see the way this dashboard is set up, that it has these kind of month intervals in CY12, calendar year 12. You're comparing, okay, if there was 9 in 2010, then you can kind of see, okay, what is it looking at? What is that trend per se? Some things they don't have benchmarks, deaths. Now the NA, not applicable. It kind of depends, and this gets at the data sources themselves. So, in terms of benchmarks, this might just be a reporting measure. So some in public health a lot, there's some where it can like that, where it will look like that. But as you scroll down, you kind of see what you're looking at when you're thinking about creating a dashboard. The measures organized by high level outcome measure, the description, the data source. You're looking at a benchmark if applicable. But and we'll get into some discussions in a little bit. But also, you know, it is just a metric in a way of measuring, assessing, and updating a presentation. You can see on this side, this is, and again, as I said, it's a little more granular in terms of the data source, the benchmark, how often is it updated, those kinds of things. But another thing that you'll see is the intervals on this right down here. So you can kind of see how important it is when you're mapping it out. Now, another item that's important to note is just kind of how often, or the periodicity is kind of the technical term for it. Quarterly data, is this updated quarterly? Is this differently? Is it annual? Is it semi-annual? Just give you a sense, semi-annual twice a year, quarterly 4 times a year. Sometimes it could be more. But a lot of, when you're looking at some data sources, just open discussion. A lot of federal data sources that are used often, and coming to mind, what first comes to mind is census. So using census data, census is reported annually. Actually, it's estimated annually. And it's actually extensively assessed every 10 years. That's called the decennial census. But in general, that data is annual, and it's kind of used a lot in a lot of health research, but also in other various research too, like economic, educational, those kinds of things. Um, so it's very important to kind of keep that in mind, and making notes of that too is when you're looking at the data sources and creating a dashboard. But really, when you think about it, I mean, the dashboard can be really kind of condensed into topics, measure, data source, the frequency in terms of the month, and kind of the outputs as it's shown here. So it's real important to kind of just keep it basic, but kind of show it's almost it is what it is. A map, a dashboard. When you think of a dashboard in a vehicle, it shows you everything you need to know, or the pertinent pieces, I guess is a better way to put it, of what you need to know that's going on with your vehicle. That's the same thing that's happened here. So when you're looking at, inpatient experience, what is the dashboard to that? Well, it involves transplants, deceased wins, survival, modern era DD survival, so, and right heart failure. So, those kinds of things. And going back to my first example, in county health rankings, what is a healthy county? Answering that kind of question. And I'll send that link will come with this video. So county health rankings is a dashboard, and you think about it in that way, that they have these determined measures, asthma, diabetes, those kinds of things, and they populate it based on national data, census, I think. And they populate it to create this kind of presentation so that someone could see in a given county, wherever in any state, those metrics. Now, that doesn't necessarily transcribe directly to a healthy county. There's kind of limitations in describing what a healthy quote unquote county is, but in terms of just based on the measures, how are each county in comparison to each other. So this is kind of initial kind of feedback, getting some questions about the dashboard and the setup, but also just feel free to email the professor. But I just want to give you a good hint, good sense of just explaining this, and just let us know if you have any questions along the way. Thanks so much.